Welcome back. Thanks very much for staying with us here on SABC News. We're taking our discussion further on our focus on early childhood development centres today. And we welcome Dr. Shaheda Omar from the TeddyBear Clinic, a centre for childhood development. Thank you, as always, Dr. Omar, for joining us here on SABC News.
Thank you and good afternoon to everybody.
As a start, how has COVID-19 and really the lockdown and all that surrounded the coronavirus affected the plight of children who need these early childhood development centres the most? And perhaps you can talk to us, please, about how the TeddyBear Clinic has really sort of coped during this time.
So I think what one needs to understand is that COVID-19 hit us all unexpectedly. It was unprecedented, and children were hardest hit by this because one of the unintended consequences was eroding children's rights. The fact that children were no longer having access to feeding schemes because of the lockdown. Children were deprived now of interaction, social engagement, of cognitive stimulation, and any other opportunity for learning. So children were suffering. There was a deprivation from different quarters. And what we found is that due to lots of challenges within the home environment, more specifically to economic struggles, unemployment, job insecurity, lack of finances, children were suffering as a result of the stresses that parents were faced with, and sometimes were victims of assault, physical assault, and I think this also resulted in violation of children. Something that we saw that the deprivation impacted on children's lives, the confusion, the anxiety, the trauma that many children faced because they could not understand or even begin to process what COVID-19 was about. And I think because of parents' a lack of information or insufficient knowledge, they were equally stressed and not in a position to share this knowledge with children. And this only created more stress, anxiety, and confusion in children, inducing further trauma, secondary victimization of children. So COVID-19 and children's lack of attendance of education, ECD facilities and centers resulted in many challenges that we were not prepared for.
And what was the worst sort of challenge you've had to kind of be faced with as the TeddyBear Clinic? I know that you deal with very many cases dealing with children, and some very, very sad ones indeed. But what has been the worst case you've been exposed to at your centre, at TeddyBear Clinic, which was a direct result of COVID-19 and the lockdowns?
So one of the severe cases that we dealt with was where children were left unsupervised, unattended. It was not purposeful neglect, it was situational, where the mother was actually attending a funeral in another province and could not return to her children. And the youngest was under the age of 5 years old. And these children, there were 3 siblings, and they had to fend for themselves. It became a child-headed household, but they had to scrape the bottom of the barrels to find food, to reach out to neighbors, and they were in an appalling state, in a very poor state. And, we've got somebody making a report, but the mother also contacted the Teddy Bear Foundation, and our manager went out there and found it in a very sad state where the children were in desperate need, that they were actually facing the point of starvation. So this is indeed a very sad case. But we've also had where children have been beaten, where they've suffered fractures, and it was inflicted by their caregivers. And again, on further exploration, it was an isolated, random incident. It was not a pattern of behavior that was common in the household.
Dr. Omar, we're hearing, of course, in the news, and you would have seen, of course, that many workers in early childhood development centres are protesting at the moment due to the fact that there is a risk of closure of many of these centres. And a survey report released in April found that 68% of ECD operators may not actually reopen, which obviously means the plight of children, some of whom you speak about, will be worsened due to that. Is that a correct assessment of the situation, that indeed over half these centres in the country may then have to be forced to shut down?
Well, I think it would be really a sad day in the history of South Africa if children were deprived this opportunity of attending ECD centres, because the deprivation, as we've discussed already, would affect them in not only physically, not only emotionally, psychologically, and even intellectually. So I think if we look at the overall well-being of the child and the best interest of the child, we're certainly not meeting the best interest of the child according to the Children's Act.
And what was your initial sort of reaction to Minister Lindiwe Zulu's announcement that 1.3 billion rand will be allocated to employ youth compliance monitors, as opposed to sending more money to these kinds of centres, which is obviously what propelled these protests that are currently on at the moment? What was your initial reaction to the minister's announcement?
Well, I think the initial reaction was disappointed and feeling for the children, the empathic response that once again children are bearing the brunt and are suffering because of top-down policies, top-down decisions being made, and we are not actually putting our ears to the ground and listening to the people on the ground. What is it that they need? What is it that they're faced with? How can we best address the situation? I think that's the important thing to understand, that we are not hearing the voices of those that we actually need to listen to.
All right, Dr. Omar, thank you very much for speaking to us. That's Dr. Shaheda Omar from the TeddyBear Clinic. Thank you, as always, for giving us your time here on SABC News.